Hey, I'm Damon Bonser, CEO here at the British Design Fund, and I'm joined today by Jonathan West, founder and CEO of Flomark. Nice to be speaking with you, Jonathan. How are you?
I'm very well, thank you. Yourself?
Very good, thanks. So we do these short little interviews to give our investors an opportunity to meet some of the founders that they're backing through the British Design Fund. So it'd be wonderful. So don't obviously disclose anything that's kind of commercially sensitive, but it'd be lovely to hear a little bit about, what Flowmark does in layman's terms, why you're passionate about it, why you set it up, and then we can talk maybe after that a little bit about some of the customers and markets you will go into.
Sure. I'll start with me. So I trained as an engineer, went to art college to learn about design, ended up leading a team of designers at the Royal College of Art, and we did lots of work in design for patient safety. So that was working on hospital wards, finding out how things are done, and finding out ways in which design could make that safer. And we did that for many years, did lots of really interesting projects, but I eventually had a hunger for how things go from concept design, which we were very good at, all the way through to people using the products at the end of the day. I wanted to know what that journey was because I wanted to look back on a career where people were using the stuff that I designed. So that was why I left that because I needed to understand the journey of raising investment, regulatory approval, go to market, all those sort of things. So the idea that I think was most excited by, stemming from some of those insights on hospital wards, was that of flow rates and fluid balance. I had identified that as a problem working with lots of doctors and nurses, but we'd come up with a very nascent, very initial idea around a very cheap flow meter. And since then, that's sort of blossomed into an infusion device and the aim to have urine output measurement as well, because those things are really important for caring for a patient.
So for those of us that haven't been in hospital recently, just in simple terms, so what is it you're talking about here? I mean, I know what it is, but just very
Sure.
simply put, where do we see these flow rates?
So, if you're unfortunate enough to be in hospital, it's likely that you'll have had an infusion. And there are two ways of doing the infusion. So, both involve hanging a bag of fluid on a pole. You stab a drip device into the base of that, and that would run into your veins. That just using gravity, and the rate at which that fluid flows is determined by a nurse counting the number of drops falling through that window. And I've never seen a nurse do this, and they would probably admit that, to be honest. So infusion rates over gravity are very inaccurate, and that's not good for patient care. If you want a bit more accuracy, you would put that tubing through a pump, but that's also not a particularly great technology, very old technology. And then on the urine output side, if you're catheterized, it's important that nurses would see how much urine you're producing. That would basically just fill up a urometer or a urine collection bag, and a nurse is supposed to look at how full that's got every hour. But again, it's not done very well because you need to determine like exactly, is it going to be an hour that you see the person's urine output rates? You have to do a calculation. Nurses are busy, they've got other things to be doing. So we've got a situation where a doctor's trying to care for a patient, but they don't really know how much fluid's gone in or how much fluid's gone out. And that's not a good situation because you want to have accuracy in the data when you're trying to find out what's wrong with the patient or how to care for them.
Understood. And then, so those are two different solutions, aren't they? So the one for the measuring the liquid coming in and the one for measuring the liquid coming out, correct?
Well, it's effectively the same technology, but we have to sort of manifest them in a different way. So you've got filters and stuff for things going into the patient, slightly more basic going out, and we'll be working on electronics, which is what this investment allows us to do. So, like I said, with drips clipping into IV pumps, our new type of drip, which shows you what the flow rate is, we're developing some electronics which clips onto that and will give more precision and automation in that. Exactly the same on the urine output, but that will be further down the line.
And what are the key sort of technical advances you need to make before this can be launched then? So I guess a lot of what the use of funds is.
So that will be we have it working at the moment. I mean, we only just secured the funds, so we're really just beginning the work, which is taking the working prototype that we have, and taking that all the way through to a manufactured, regulatory approved product. And so that has obviously has some technical challenges, but we've sort of ironed quite a lot of the fundamentals out by the fact that we've got a working prototype. But then we have to, talk about component selection, talk about various different use cases and how robust it would be with all of that. But I guess more of the lion's share of the work will probably be the regulatory approval. So that's getting all the technical file together to demonstrate, test, and show that it's reliable and fit for the clinical environment. That's the most of the work that we're going to be undertaking in the next year or so.
And what might seem like a silly question, but what would be the measurable sort of impact of this technology? So say 5 years down the line, what if a hospital was looking back and saying, since we've implemented Flomark technology, what would you expect? What would be the impact within that hospital?
Sure. So we're actually staging the releases of the different products. So the first one is the replacement for a drip. So by implementing that, they would see a reduction in nurses running around looking for pumps. So there's a direct saving there, but also much improved accuracy for gravity infusions. So that's the first thing, and hopefully impact on patient care. When we introduce the electronics, they will see their expenditure on drips and pumps probably half. So great savings on that. And then when we've done that and the urine output stuff, we'll have an overarching system which will tell doctors the fluid rate coming in, or I guess the fluids in rate and the fluid output rate, and therefore doctors will have reliable data on which to work. And that has a huge impact actually. The value of the data is massive, because if you mess up a patient's care by not understanding the fluid balance very well, you can cause acute kidney injury or fluid overload, and these are very bad things. You could kill somebody with these things, and there are basically various different studies which quantify the cost of an acute kidney injury patient, for example. Now there are different stages of it, but off the top of my head, one of the studies shows that an acute kidney injury patient would cost an extra £12,000 to the hospital. So obviously, if we can make a reduction in those things happening, there'll be much bigger savings for hospitals.
And of course, this patient suffering and all the other positives associated with it. Okay, very good. And then, how will you get this ultimately into the hands of nurses and attached to, IVs that are going into patients? Like, what's your route to market, do you think?
Sure. We have a company who is already on the NHS framework for infusion devices, and that's important because if you're not on that list, it's very hard to get on that list as a new startup. So they will be selling it for us effectively, which is a massive sort of leg up for a company in our position, and we're hoping to pull the same trick. What's actually important is we've designed them, all of our products as we release them, to fit in with not only with clinical workflow, so we're not asking people really to change very much about what they do on a ward, but also fit in with the way the NHS buys things, because they have like categories and frameworks that they would use, which has sort of tight product specifications. So they'll say we need a drip that does X, Y, and Z, and then companies would respond to that. But if we can get onto those frameworks, that means that we can just be bought in the same way as current devices, which will make everything a lot easier to roll out into the NHS.
Very good. Jonathan, I think that's been very insightful. I've even learned a few bits there that I didn't pick up on sort of previously talking with you. So no, really excited to have be part of the BDF portfolio. We look forward to supporting you up to launch and beyond, and improving sort of patients' lives and also helping those trusts kind of save some money as well, ideally.
Smashing. Well, thank you very much, BDF, for all your help and faith going forward.
Great. Thanks a lot, Jonathan. All the best.
Thank you. Thank you.